See what's going on the front lines. Pastor Helton works as a respiratory therapist. Not only is he a pastor, but he works right on the front lines in the hospitals. I'm sure he's experienced a lot of uh, death and a lot of suffering while working as a respiratory therapist. And we try to keep in touch with him. I know we're always praying for him and with him. So I'm going to ask Pastor Helton to come in right now and tell us about what's going on the front lines. Pastor Charles, are you there, sir?
I am. Hey. Hello, everybody. I'm Pastor Charles Helton with Heritage Christian Center. I work as a respiratory therapist for Centura Healthcare, and I've been in the fight since day one. It's right now we've kind of subsided a little bit, getting some relief, but we've been in some battles. When we think about biblically, we think about the pestilence that was talked about in the Bible. And when we look at the definition of pestilence, we look at really what we're dealing with, which is definition of a pestilence is any infectious fatal disease that is widespread or an evil influence or deliverer. And we're dealing with that for the last 9 months, almost going on a year. I think our first case was in February of last year. And as Pastor Whitmore said, we're dealing with a lot of death. And in the beginning, we didn't know what we were dealing with. So we lost a lot more people than we are now. But we've learned some tactics. We've got some treatments. And as everybody knows, we have the vaccine out now. So a lot of healthcare workers are taking the vaccine and experiencing some symptoms with the vaccine, but are feeling pretty good about it after they go through those symptoms.
Mm-hmm. Tell me a little bit, Pastor Charles, what type of symptoms are people experiencing them? And is it a few people, a lot of people? Is it specific to any age group or ethnicity? Talk a little bit about that.
So, I mean, as far as it goes, when we first came out, it was a lot of the elderly that were really dealing with that. A lot of they had the class of the 60 and above. As it started progressing a little more, I've had a patient as young as 21 years old that we didn't think was going to make it. And we had to send to a special procedure where at that age, even healthy with no underlying disease, dealt with near death. We didn't know what we were going to do for him. We sent him through a procedure that's called ECMO, which really just goes through the blood system and cleans it out and tries to get the disease out. Some of the symptoms that we're dealing with, a lot of people hear about the respiratory, and as far as dealing with the lung issues and pneumonia, we call it COVID pneumonia, but another underlying thing that's happened is affecting the bloodstream and causing blood clots. And what we're seeing with the blood clots is the sudden desaturation where the oxygen levels in the bloodstream drop rapidly. And some of them, the embolisms are so big that there's nothing we can do in time to be able to stop the process of death with it. Usually we'll try and do something that'll blow up the clot or grab it and push it out, but we don't even have time to do that. I've seen people that have literally come in the hospital short of breath up and talking to us and decline so rapidly that we have them on a ventilator within an hour and a half. And then we do this procedure that's called proning them, which basically we lay them on their belly, which helps to open up the lungs in the lower areas so that they can get the oxygen exchange and gas exchange they need to survive it. If we can do that. And then we have what we have now compared to what we had at the beginning is drugs, Dexedrine and remdesivir, which were given to people over a couple of days time. I think it's 5 to 7 days or up to 10 days. That is kind of helping reversing the symptoms. Other symptoms are people are not able to taste their food or their drinks. They lose their taste and their sense of smell. So these are just things that we're dealing with, and everybody's coming in with a variety of symptoms that we're having to manipulate. And on top of that, we're having to deal with people that aren't having any COVID symptoms on top of that. And a lot of our employees are burnt. They're tired. They're emotionally drained. We don't anticipate in the hospital. We know we're going to see death, but we don't anticipate seeing death at the rate. And then, as I think I stated in the last time I was on here, was these people are dying alone because they have the COVID. The families can't be with them.
Wow. We're going to take time out sometime during our broadcast, and we're going to pray again for our first responders and the people that are out there. But tell me a little bit more, Pastor Helton, about how this is affecting the pastoral care in the hospital. I did what's called CPE, and I was a chaplain at Presbyterian St. Luke when it was before they remodeled it.
Yeah.
Years ago, I was involved in a program down there, and I know it's very, very important for most people to get a visit from a chaplain, get a prayer. That was people of all faiths.
Right.
The one thing that a lot of people, especially ministers, don't realize is when you go into a hospital room, that's probably the most vulnerable position that you'll ever see somebody in, is away from home, wounded and naked, pretty much like the Samaritan, like the man who went down from Samaria. And we all know the story. Those of us that are Bible goers or church goers, we know that, the rabbi passed him on one side and he was passed on another side, but it was a Samaritan that came along and helped him. So what's happening with the chaplains? Are the chaplains able to make any contact or be a liaison, or how is that working?
Yeah, the chaplains, a lot of the chaplains I know, obviously being a pastor, I try to communicate with the chaplains on a regular basis. I'm pretty good friends with most of the chaplains at the hospitals I work at. And some are tired, some are drained, but they are very needed. They are the liaison to these patients that the families can't see. And they're the ones that are calling the families and really trying to help them get through this process. And sometimes they have to be in all the family meetings that are discussing withdrawing care because there's nothing else that the doctors feel that can be done for the patient. And so they have to deal with that. They're making phone calls. They're getting powers of attorneys. A lot of them are so great that they actually also fix themselves on helping out the staff. They recognize, I've had them ask me a couple of times, how you doing? And they're the one group that I can really be honest with. I'm just having a hard day today with this. There's days I come home crying. There's days I come home where I don't want to listen to anything on the radio. I just come home and drive home in silence. And some of those drives are from, I drive all the way from St. Anthony's North down to Parker. So, that's almost a 45-minute drive.
Wow. And for those of you who have just tuned in, or you may be scrolling through this program, what we're trying to cover now is how we as the church, as ministers, men and women called of God, how we can do ministry outside of the four walls. Over the past 20, 30 years, we got pretty comfortable inside the four walls. Now, that doesn't mean that there's a lot of churches out there I know that are doing very good outreach ministries and have very, very good programs. But right now, God has shut a lot of that down. And there may be some people that are watching this program that want to know, how can I help? How can I still do ministry? I told a group of pastors tonight, I've been a paramedic. I've been a social worker. I've been a coach. all things that involve people. And I just believe that whatever, and even this program here involving people, I just like to do people. And I know there are people out there also that have been maybe quarantined or shut in who like to serve. Believe it or not, there are people who like to serve. Everybody's not in this for money. I've never made a lot of money in ministry. Uh, so there are people that like to serve. I come from a serving family. My mother was an RN. She's a director of nurses. Both my sisters are in social work. My older sister is a school teacher. My daughter, who even runs this program, works for uh, Department of Social Services in Michigan. So we're just people. So, but I know that there are others out there right now. You may want to get connected too. So, what we're trying to cover tonight is those people who are out there uh, that are in need of ministry, or those people that may be watching that want to get connected. There are
Absolutely.
many good churches out there, but I want you to know that Heritage Christian Center is a very good one, and we've got some programs where you can get connected and stay connected. We are always praying for you and with you, Pastor Charles. Hello, my name is Pastor David Whitmore, and I want to invite you to join us every Thursday evening, 8 p.m. Mountain Standard Time, for Ask the Pastors. We have a host of pastors available to answer your questions, to take your prayer requests, and just be available for you in these different and difficult times. Join us.